Thank you, Mr. Chair, for calling this an important hearing. I only regret that it conflicts with a members-only briefing on almost the exact same title taking place simultaneously. And thank you, witnesses, for the important work that you do every day, thinking about ways to combat public health threats. There's a common theme across your testimony, and that's pretty much when there's a crisis, all eyes turn to you. But when the disease of the crisis moves off the front pages, the public loses interest, and then the funding goes away. You didn't say this part, but I'll say this also, that when Washington sees a problem, the habit is to throw billions of dollars at it and say, look, now we've done our job, and hope for a good result, and move on to the next issue. And of course, there's always the finger pointing and blaming based on, as you well pointed out earlier, much information and disinformation. That's really regrettable, and I think the American people are getting a little tired of that. But Dr. Murray, working with partner agencies, you state you've successfully identified over 1,200 novel wild-borne illnesses, including 161 of which belong to the same family as COVID-19. I think most of us in the room are wondering what the risk to humans is from those viruses as well. I have four related questions that I'll ask you after that.
Thank you very much. I'll try and be quick in my response. So in addition to identifying the viruses, we also have the team of modelers who helps us identify where to look in the world. We also have a team of phylogenists and virology experts who then rank all these viruses. If we had enough money to look at every country, every species, every animal, we would, but we don't. So we really try and use funds effectively. So we identify the countries in which are most likely to be a problem, the species that are most likely to transmit lethal diseases to humans, primates, bats, and rodents. And then of those 1,200 viruses, they're ranked according to the families that are most likely to cause a problem for human health. And that's where we spend the majority of our time and resources. Influenzas, coronaviruses, filoviruses, and paramyxoviruses are some of the most important families. Just to add on to what my colleagues here have said, it is the time funds are an issue, and the program that I'm describing is just in the process of being closed down. We're actually holding our closeout session on March 17th at the Museum of American Indian, in case anybody would like to join us, because we'll be reporting on a lot of what we've done over the last 10 years. My suggestion would be this is not the time to lean out, but it'd be the time that we need to be leaning in.
Yeah. What percentage of the viruses have the potential to jump to humans? Just swag it. I mean, just.
So of the 1.7 as yet unidentified viruses, about 50% of those have the potential to jump to humans, and that's based on the receptor sites and where they can attach to the trachea. Of those, but not all of those are going to spread rapidly, and not all of those are going to cause severe disease. So we look at, there's 50% that could jump to humans, and probably only 10% or 15% that can cause rapid disease and a pandemic. But until we identify those viruses, the species in which they occur, the reservoir species, and the mode of transmission to humans, we're really still at a tremendous risk. And then the research has shown that these outbreaks are coming more and more frequently. So while everybody, a lot of us have felt like, oh, this is a surprise, the folks in the health community have felt like this isn't a surprise. We've been saying it collectively for the last several years. These pandemics are coming. We can tell you in general, the countries or the areas, some of the risk factors, and some of the viral families.
Okay. Well, you answered my next two questions about the percentages already. So for the final question, how do you think we best prioritize research? You know, is there a good process to set research priorities in place?
I think a lot of what we're doing right here, and thank you for this hearing, it does bring everybody, a lot of the same folks into the room to help identify some of the issues. From my perspective, the more that we can look at bringing experts from many different fields, from the government, from NGOs and universities together, then that, and the confluence of human physicians, well, most physicians are human, right? So human physicians, veterinarians, nursing staff, researchers, I think that's really what we need to be doing and looking at, not only in the US, but in countries, in other countries as well, because we look at the economy globally, it's really time for us to look at health globally. So that's how I would go about establishing research priorities.
Thank you. That beats crisis du jour.
Thank you for your questions.